guys. Hello. Hi. Hello. Come.
Hello everybody, welcome back to Dr. Nailil. This is Dr. Nailil Talks and Food. Welcome.
Hello everybody. Welcome back to Dr. Nailil Show. Did you know that HIV AIDS is among us? Do you know what HIV is? Let's find out. HIV is a virus attacking the body's immune system. And what is AIDS? AIDS, it means acquired immunodeficiency syndrome that occurs mostly at the advanced stage of infection. HIV targets the body's white blood cells and weakens the immune system. This makes it easier to get sick with other diseases like TB, like cancer. How is the HIV spread? You can get HIV from body fluids of infected person, like blood, like breast milk, vaginal fluids, from mother to baby, and even semen. But you cannot get HIV by kissing somebody, by hugging somebody, by sharing food, by sharing water. You cannot get HIV from that. HIV can be prevented and with the treatment called antiretroviral treatment. Untreated HIV, it will progress to developing into AIDS, and that will take many years. There's an organization called WHO, and it defines advanced HIV disease as when you have CD4 cell count of more than 200. All children less than 5 years of age living with HIV are considered to have advanced HIV disease. What are the signs and symptoms of HIV AIDS? HIV AIDS depends on stage of infection. Like, in the first few weeks of getting infected with HIV, some will get flu-like symptoms like fever, headache, a rash, a sore throat, and afterwards it may not cause any symptoms and may remain dormant for years. As the immunity of the body weakens, you experience swollen lymph nodes, weight loss, fever, diarrhea, cough. If no treatment is initiated, HIV-infected people develop severe sicknesses like TB, cryptococcal meningitis, severe bacterial infections, cancer like lymphomas, and Kaposi's sarcoma. So there's a note to point. When you have HIV, it causes other infections to get even worse, like hepatitis C, hepatitis B, monkeypox. Those people who are taking ART and are living with HIV and have undetectable viral load will not transmit HIV to their sexual partners. So early access to ART and remaining on ART will improve the health of the person with the HIV and will prevent that person from transmitting the virus to another person. What are the risk factors associated with the HIV AIDS? By saying risk factors, we mean the behaviors and conditions that put people at risk of contracting the HIV. 1. Anal or vaginal sex without condom, having STI like syphilis, chlamydia, gonorrhea, bacterial vaginosis, herpes, those can put you at a risk of contracting HIV. Harmful use of alcohol or drugs in the context of sexual behavior. Sharing contaminated injectable equipment like syringes. Receiving unsafe injections, getting unsafe blood transfusion, getting unsafe tissue transplant. Medical procedures that involve unsterile procedures like accidental needle injuries, piercings, cuts from infected tools. How do you know that you have HIV? You can diagnose that you have HIV if you do self-tests, but in order to know that you have HIV, you need confirmatory tests, and they are done by qualified and trained health workers. When you get infected with HIV, the body produces antibodies as immune response to fight the virus. This happens within 28 days of infection, and when you are in that stage, it is called window stage. This window period, people have low levels of antibodies which can't be detected by rapid HIV tests, but the people in the window stage can still transmit HIV to other sexual partners. For children under 18 months, rapid antibody tests are not sufficient to identify the HIV virus, so virological tests are provided as early as at birth or as at 6 weeks. How do you prevent getting the HIV/AIDS? Use of male or female condoms during sex, get tested for HIV or STIs, have a voluntary medical male circumcision. For those male who are not circumcised, it is essential that you undergo the circumcision willingly. Using safety measures for people who inject others or use drugs. If you are a health worker, if you are somebody who uses needles, use them cautiously. There are medicines and medical devices to help prevent HIV infections like ARVS, and ARVS can mean the pre-exposure or post-exposure prophylaxis. There's something called dapavirin vaginal rings. There's something else called injectable long-acting cabotegravir. Those will prevent you from getting HIV virus. ART drugs given to people without HIV to prevent infection include pre-exposure prophylaxis. It's called PrEP, given before the possible exposure to HIV. If you have a partner who has HIV, or you are going to expose yourself to HIV, you get the PrEP. And there is a post-exposure, which is given because you have already gotten yourself contaminated with somebody who has HIV. Does HIV has a cure? There's no cure, but if treated with ART drugs, it will stop the virus from replicating and makes the body's immunity to be stronger, hence it can fight other infections. Take ART for the rest of your life and lower the amount of virus, and if taken correctly, you will have no evidence of virus in blood, hence can't spread to your sexual partner. People taking ART and have no evidence of HIV virus in their blood will not infect their sexual partners. There are measures to prevent you from infecting your partner. Pregnant mothers with HIV should take ART drugs as soon as possible to protect themselves and protect their unborn baby, because transmission of HIV virus is before birth and through breast milk. Who should take pre-exposure ART? Pre-exposure ART will protect you if you don't have HIV but have had anal or vaginal unprotected sex in the past 6 months. You need to take the PrEP. If you have had a sexual partner with HIV, you need to take PrEP. If you have not consistently used a condom, you need to take PrEP. If you are at a risk of getting HIV from sex or injecting drugs to those who are infected, you need to take PrEP. Use PrEP on time and every time. How do you know if a man has HIV? The only way to know that a man has HIV virus, it is for him to get tested. However, some males can experience these symptoms: low sex drive, they can have pain when they are peeing, and sores on their genitals. By genitals, you know what I mean. That is it for today. Thank you for being a subscriber. Thank you for listening to this educative content. Actually, subscribe, like, comment below. If you are a new subscriber, welcome, and thank you for being a subscriber. Continue watching this video. Bye. Love you.